My name is Kristine Hopkins, and I'm a co-investigator with the Texas Policy Evaluation Project, or TexPEP, at the University of Texas at Austin. I'm going to talk about a study we did about contraceptive use and preferences among community college students in Texas. We published the study in 2018 in the Journal of American College Health. Because community college students who have a child while in college are 65% more likely to drop out than women who don't, we wanted to address two main questions. Do female community college students want to use effective methods of contraception? And if they want to use effective methods, are they able to access them? Effective means that 9 or fewer women in 100 will get pregnant while using the method of contraception over the course of a year. Effective methods include the IUD and implant, which are sometimes called long-acting reversible contraception, or LARC, and hormonal methods like the pill, ring, patch, or shot. Condoms, withdrawal, and of course no contraception are considered less effective methods. Community college students experience several risk factors for unintended births. Many are between the ages of 18 and 24, which is the age group that has the highest rates of unintended pregnancy and birth. Many are also lower income and minority students who are more likely to experience unintended births than higher income women and non-Latino white women. Community college students are also less likely than four-year college students to be insured or to have on-campus health centers where they could get reproductive health services. In our study, we received surveys from 1,512 female students aged 18 to 24 from the 3 community colleges included in this study. I'm going to present the results for the 966 young women who provided complete information and were considered at risk of unintended pregnancy. What did we find? We first asked women what birth control method they or their partner were using at the time of the survey. We found that 9% used an IUD or implant, 21% used a hormonal method, and the rest used condoms or withdrawal or no method. That means that 30% of the women in our study were using effective methods of contraception. Next, we asked the young women what method they would prefer to be using with the question, if you could use any birth control method you wanted, what method would you use? We found that 21% wanted to use an IUD or implant and 47% wanted to use a hormonal method, with much smaller percentages wanting to use condoms or withdrawal, or who didn't know which method they wanted to use. Therefore, 68% of the women wanted to be using effective methods, but less than half that number, 30%, were actually using them. This large discrepancy illustrates an unmet demand for effective contraception among community college students. Among the young women who wanted to use effective contraception but weren't, top reasons were financial, such as not being able to afford the method, and informational, such as not knowing where to get the method. In sum, we found that a large percentage of young community college students wanted to use effective contraceptive methods, but many weren't able to access them. Community colleges could implement several strategies to help students avoid an unintended birth. Colleges could provide information about enrolling in public or private health insurance, pregnancy prevention, and contraceptive methods during orientation and in academic courses, as well as in campus events programming and through peer-to-peer and staff-to-student mentoring. Colleges could also connect their students with local family planning services. Local family planning clinics could also improve outreach to community college students to let them know of low-cost family planning services available in their communities. Our findings suggest the importance of increasing access to effective methods of contraception through improved health insurance coverage and low-cost contraception. They also suggest that providing students with information about pregnancy prevention and providing better access to low-cost family planning providers could increase the use of desired effective methods. This, in turn, could decrease unintended births among community college students and improve their chances of successfully completing college.